Good, good afternoon, everybody. My name is Stacy, a fellowship student from the Geriatric Clinic and Services Department of Psychiatry, NIMHANS. Today we have our episode 242 of our Healthy Aging series, and the topic is pulmonary issues in the elderly and its prevention. According to the United Nations World Population Prospects in 2022, there are over 71 million aged above 65 years, making up nearly 10% of the global population. With the world's population steadily aging, pulmonary diseases in older adults have been an increasingly important public health concern. Within this context, the prevalence and burden of pulmonary diseases among older people are poised to escalate, necessitating proactive measures to mitigate their impact on public health and healthcare systems. This makes it crucial to adopt proactive strategies for prevention, early detection, and management. Understanding the unique Understanding the unique challenges of pulmonary health in older adults is essential for promoting their well being and enhancing their quality of life. With that being said, I'm delighted to welcome Dr. Karthik Adiga B, our esteemed speaker for today's Healthy Aging Talk series. Dr. Karthik is currently serving as an assistant professor of respiratory medicine at Dr. B.R. Ambedkar Medical College and Hospital, Bengaluru. A gold medalist in MD respiratory medicine from RGUHS, he brings with him a strong foundation in pulmonary interventions, ICU care, and medical education. He also holds memberships in leading respiratory societies, including the European Respiratory Society and the Indian Chest Society. Let us warmly welcome Dr. Karthik as he guides us through this important discussion. Sir, we are honored to have you here.
Welcome, Good evening. Thank you so much for that introduction. If I can share the screen, please.
No, you can, doctor. You can. Your screen sharing is enabled. Yes.
Yeah, hope it's visible, is it not? Yeah.
Yes, doctor.
Yeah.
Okay.
Okay. Good evening to one and all present here.
You can go to full screen. You can go to full screen.
It is full screen, sir.
It is, doctor, you have to go for full screen. It's still in this thing. Up for full screen. Now it is full screen, doctor.
Okay. So it gives me an immense honor to address this gathering for a very special topic which we usually neglect. So respiratory problems in the elderly and their prevention. So considering the amount of OPD cases that we see day in and day out in our respiratory OPDs, almost around 25% of all walk-ins in any given hospitals are due to respiratory problems. So this highlights the importance of respiratory problems in the Indian population. But unfortunately, it's often neglected, and the diagnosis of the respiratory diseases is still to go a long way. So with this background, we'll see what are the changes that happen in an elderly patient who comes to us in a respiratory OPD. So why respiratory problems are common most in elderly population? So if we see, as we know that aging affects every organ system, including our lungs. So there are two types of changes in the lungs that happen usually. One is the functional change that happen, that is the ability of the lungs to make the breathe reduces as we age. Secondly, there is anatomical change, that is the elasticity of the lung is lost. It's reduced every year. So this is the reason why elderly individuals are more susceptible to most of the respiratory issues, including infectious diseases and non-infectious diseases like airway diseases. So if we see what are the changes that are going to happen in elderly patients, one is the age-related changes, which I discussed with you just now. Second most important thing is the reduced immunity, which occurs as a natural cell senescence phenomena. Our immune cells are weakened as we progress with age, and hence our respiratory defense mechanism is a little low when compared to younger individuals. That's why respiratory infections are commoner and severe in elderly patients. Thirdly is the comorbidities, that is diabetes, hypertension, ischemic heart diseases, and seizure disorders. All these disorder adds to the burden of respiratory illnesses as we age. And fourthly, and most importantly, it's the environmental exposure. So in the recent times, this environmental exposure has gained a lot of significance, may it be the indoor air pollution or the outdoor air pollution. So it need not always be smoking and smoking associated lung disorder, but indoor exposure like biomass fuels and house dust, animal danders, all these contribute to the exposure. And when it comes to outdoor air pollution, as we all know, India has a very high burden of air pollution when in worldwide, and in major Indian cities are combating this problem day in and day out. So this makes it very challenging for a respiratory physician to manage the cases along with existing environmental exposure. So I explained you this already. One is the reduced elasticity of the lung. That is, the lung becomes more and more stiff and it is unable to expand and collapse as in a normal healthy individual. The ballooning effect of the lung is reduced as we age. So this makes the lung very stiff and makes it difficult for a patient to take his breath. Second is the weakened respiratory muscles. As we all know, there are muscles which help a person to breathe. So all these muscles of the abdomen and the back are helping in bringing about the action of respiration. And as the age advances, as the muscles become weaker and weaker, this action of the respiratory muscles also becomes weaker. And thirdly, the reduced immune function, which we described already. And fourth important thing is the diminished cough reflex. So cough is a very much protective reflex that happens in a normal healthy individual. So cough is produced as a result to throw out whatever foreign body is there inside the airway or the airway passage. So when this cough reflex is lost, it aids the pathogens or the infectious agents to enter inside the lung and cause certain diseases. So this is again a very important factor in causing respiratory illnesses. So having said all this, now we'll shift our focus from what are the common respiratory problems in the elderly population. If we see, the first one is the chronic obstructive pulmonary disease called as COPD. This will be going through in detail in the coming slides. And next will be the bronchial asthma, which is often neglected and seen as a disease of the young. But it is important to note that this asthma can affect even the elderly populations. And thirdly, the pneumonia. We may all have heard pneumonia is the infection of the lung. Infection by various bacteria, various fungi, various viruses can affect the lungs and it causes condition known as pneumonia. And fourthly, it is the pulmonary fibrosis. Fibrosis is cobwebbing of the lung. The lung becomes very stiff and the patient is unable to take his breath, as a result of which patient presents to you with breathlessness. This is known as pulmonary fibrosis.
Doctor, can I just suggest one thing, Doctor? Your slides
Yeah.
are not moving. Yeah. Your slides are not moving.
Yeah. Okay.
Now it has now come to the common respiratory problems in elderly. Yes.
Okay.
Now it has come to that, but the earlier slides it was only at the first slide.
Okay.
No problem, Doctor. Now it's go ahead, please.
Okay. Next, we have what is known as lung cancer. As we all know, lung cancer is the most prevalent cancer in India. And next, we have emerging disease known as sleep apnea, which we are going to see it in the later slides. And next, most important and the most significant over the past 4 or 5 years is the post-COVID sequelae or the long COVID syndrome. So we are also going to shift our focus in the coming slides about the long COVID syndrome. So, as I told you, tobacco smoke exposure is the most common pathogenic exposure to a patient's lung. So, it may be active smoking or passive smoking. Active smoking, as we all know, a patient who is actively smoking is always susceptible to diseases. But passive smoking, or what is also known as second-hand smoking, is exposure of the smoke of of a person who is smoking to a person who is a non-smoker. So if you are surrounded by people who are smoking, then that smoke itself can affect you and your lungs and cause some diseases. This is known as second hand exposure or passive smoking. So, and I again described indoor and outdoor air pollution for you. Indoor air pollution need not just be the dust which we see. It can be animal dander, hair, and some people have the habit of uh, rearing pigeons and other birds. Their droppings are also equally pathogenic, and uh, this damp places in rainy seasons can form molds and bacteria which can cause respiratory allergies, and chemicals from various paints and all these chemicals, pesticides, and these phenols and electronic devices, all these constitute to indoor air pollution. Outdoor air pollution, as we already discussed, it can be from the industries, it can be from the chimneys, it can be from the factories, transport, traffic, open air burning, and emissions from the vehicles, and road dust. So after having considered all this, we'll see this very important slide. If we see this green area which we see is the normal lung function decline which happens with age. Lungs start declining in its function after the age of 25. Till 25, one is able to breathe to his fullest capacity, after which every year around 25 to 30 ml of lung function is lost. But this is accelerated if a patient is smoker, or if, as I told you, if a patient is exposed to too much of industrial pollutants or biomass fuels. So as we can see, the red line shows accelerated lung function decline. This accelerated lung function decline manifests as various conditions, most common condition being what is known as chronic obstructive pulmonary disease or COPD. So we'll see one by one. Now we will come to what is known as COPD or chronic obstructive pulmonary disease. This is one of the most important disease of respiratory system in the elderly patients. Previously, it was a disease particularly of the elderly patients, but due to due to all these environmental air pollution and all such factors, the age of incidence has come down to the age of 45. We can see patients with COPD coming to us at the age of 45 itself nowadays. So previously, the thought process was like COPD is a disease of smokers. Now the shift has changed from smokers to non-smoker. Even non-smokers are equally getting COPD. Why? So as we all know that the traffic outside, the air pollution outside, and even in the inside is increasing day by day, and all these bring about modifications in our airways, which causes airway inflammation. Once airways are inflamed, there is airflow limitation. That means that we can breathe in easily, but we cannot breathe out easily. So what happens when we can breathe in easily? All the inspired air gets trapped inside the lungs. So this is called as air trapping. And one is unable to exhale the trapped air. This causes permanent damage to the lungs. This is called as COPD. And how does the patient come to us with COPD? There he can present with dyspnea, he can present to us with cough with expectorations, that is sputum production. And once such patient comes to us, we do what is known as spirometry or the lung function test, PFT, which is popularly known as, and we'll get a chest X-ray done. We ask his detailed history of how long the symptoms have been, and had he had any history of usage of inhalers or nebulizations in the past, and come to a diagnosis of COPD. Once we make a diagnosis of COPD, we start him on appropriate inhaler therapy and assess his functional status, and accordingly we'll start him on oxygen therapy if required. And the most important thing, to stop the exposure. If it is smoking, then stop the smoking cessation. If it is biomass fuel exposure, shift to a very conservative mode of cooking. So this COPD, what we discussed, is not a very disease which is restricted to the respiratory system. It involves every other system. So it's a state of systemic inflammation. Once a patient is affected with COPD, he can present to you with so many ways. It can aggravate his already existing ischemic heart disease, that is heart-related diseases. It can aggravate his diabetes and hypertension. It can cause anemia or stroke. Even it can cause anxiety or depression due to restricted movements. Patient is unable to move outside, as a result of which he is idly sitting inside, and it makes him depressed. So it's a disease of systemic inflammation. So a patient with COPD can have multi-system involvement and needs a comprehensive care of all the treating doctors. So next common illness in India is pneumonia. As I told you, pneumonia is what is called as infection of the lung. So infection need not always be due to bacteria. It can be due to non-bacterial or non-infectious causes of pneumonia can be there. Like again, dust, silica, any chemicals or toxic fumes, gases, all these can cause a condition called as pneumonia. In India, most common organisms are Streptococcus pneumonia, H. influenza virus, what we call as bird flu, swine flu, which we see in the winter season every year. And the COVID itself was a cause of pneumonia in the previous 3 years. So in this pneumonia, again, patient presents to us with high-grade fever. He present with cough with purulent sputum and breathlessness. So we do a chest X-ray and get his sputum tested for all the pathogenic microbacteria, and we get the results and start him on a particular antibiotic to which he should respond to the treatment. But the major concern is, in elderly patients, it's very difficult to treat a pneumonia patient. Why? Because of the decreased immunity. So prevention is better than cure. So we advise them pneumococcal vaccination or adult vaccination, which we are going to see in detail in the coming slide. So next common disease is bronchial asthma. Bronchial asthma is typically seen as a disease of adolescents. It starts in childhood and seen in adolescents. But this is not always the case. So it need not always be in the younger age group. So many times what happens is environmental exposures occurring in the mid and the late ages also can trigger development of bronchial asthma. And there is something known as cough variant asthma, where the patient, as soon as he sleeps, it triggers his airways and starts coughing out, and it doesn't respond to normal cough syrups or any normal supportive treatment. And once we do bronchodilator testing, it will be positive. Once we do the PFT, it will be positive for bronchial asthma. And it can also be something related to obesity as well. It is known as obesity induced asthma or neutrophilic asthma, where a patient who is obese can develop bronchial asthma at a later stage of his life. So these patients present to us with wheezing, coughing, and breathlessness. Again, we assess him by doing a spirometric analysis. We assess and then we initiate on proper inhalational medications and bronchodilators and keep the asthma in control. So as I told you, this is what happens in bronchial asthma. If you see on the left side, the bronchial epithelium or the bronchial outline is swollen so much and is inspissated with mucus. The entire air passage is blocked. This makes the patient to bring about wheezing. So he presents to us with wheezing. Once we treat with bronchodilators, this bronchospasm is relieved and comes back to the normal position. So next will be what is known as lung cancer. Lung cancer is the second most common cause of cancer deaths in India. So as the age progresses, the incidence of lung cancer in India is more. Previously, again, it was attributed to smoking alone, and now the shift of focus has happened from just smoking to all the pollutants internally and externally, as we discussed previously. So how do a patient with lung cancer presents to us? He also initially presents to us with cough, weight loss, and hemoptysis. Hemoptysis means a coughing up of blood. So these symptoms are very typical of lung cancer, but not restricted to lung cancer. These are vague symptoms. He can present to us with any form. So many times we see that patient doesn't have any respiratory complaints at all, and patient presents to us with some other systemic complaints like pain abdomen or drooping of eyes or headache, and incidentally lung cancer will be found. So again, prevention is better than cure, and early screening of high risk patients. Who are these high risk patients? Ex smokers and active smokers who are already diagnosed with chronic lung conditions like, as I discussed, bronchial asthma, COPD, pulmonary fibrosis, or occupational lung diseases. These patients are called as high risk groups. They must undergo screening every year with a low dose CT scanning in order to prevent the incidence of lung cancer. And when it comes to the treatment of lung cancer, it itself is a different arena. We have so many surgeries, chemotherapy, radiotherapy, and palliative medications which are available. So next most important disease of the modern days or the past 2 decades is this obstructive sleep apnea. Previously, this incidence of this disease was grossly in very minimal numbers, but over the past 2 decades, this incidence has been enormous, and the testing of this obstructive sleep apnea is becoming very popular these days. So, what is this obstructive sleep apnea? Obstructive sleep apnea is obstruction of the airway during sleep, which causes common symptom, which is snoring, and as a result of which the sleep will be disturbed in the night and patient will have excessive daytime sleepiness. So patients to present us with early morning headache, daytime sleepiness, and sleepiness while watching TV, mobile phones, and during traffic when he is idle. And patient complains to us with confusion and forgetfulness and snoring during the night times. So, what are the risk factors for this obstructive sleep apnea? The major risk factor is obesity, and secondly, it is the elderly age group again, and thirdly, it is the metabolic syndrome. We have something known as metabolic syndrome, which encompasses the diagnosis of hypothyroidism, diabetes, hypertension, and hypercholesterolemia. All these are forming a cluster of diseases known as metabolic syndrome. These are the risk factors for this obstructive sleep apnea. So we diagnose it by a test known as sleep study or polysomnography, which can be done in even at home setup nowadays. Previously, it was done only in institutional setups. Now the sleep studies have become very popular and can be done even at home setups. Once we establish a diagnosis of sleep apnea, patient will be put on CPAP therapy or continuous positive airway pressure therapy with mask ventilation, and he will be advised for weight reduction and lifestyle modification, and something known as positional therapy will be advised to that patient. So if we see the two images, we can understand this obstructive sleep apnea or OSA very easily. On one hand, you can see the normal breathing during sleep. The airways are very much patent here. The tongue and the epiglottis are allowing the air to pass. Whereas in the second image, we can see that the airways and the tongue are very much narrowed and not allowing the air to enter the air passage. As a result of which, the air gets trapped inside and causes the effect known as snoring. So once we give this mask ventilation or CPAP ventilation, it drives the air in pressure, as a result of which this tongue comes up and allows the air to pass inside the lungs. So we'll discuss the most important topic for today, that is adult vaccination for respiratory health in the elderly population. Just like how patients, a pediatric population is involved in national immunization program, similarly we have something known as adult vaccination for respiratory health. And however, the advocacy of this adult vaccination has not been so much in vogue nowadays, but however the recent trends has been to vaccinate elderly against common respiratory pathogens. All the recent guidelines by the government as well as private sectors are advocating for adult vaccination nowadays. So who are eligible patients for this adult vaccination? So any patient above the age of 60 years and fall into the high risk category, that is with any comorbidity like diabetes, hypertension or previous known lung condition, are eligible for adult vaccinations. So why should they get vaccinated? Do Does this vaccination prevent them against all respiratory diseases? Definitely not. But it reduces the severity of those respiratory infection. What could develop as a pneumonia can be just presenting as an upper respiratory infection and wane within 4 to 5 days. So that is the importance of this vaccination. So most commonly what is given to uh, currently is influenza vaccination. Influenza vaccination or flu vaccination is given every year because the strain keeps changing every year. So it is usually given before the onset of winter season, that is usually between September to October, and it prevents flu and severe forms of influenza pneumonias and hospitalizations associated with influenza. Secondly, the pneumococcal vaccine. PPS, we have two formulations. One is the pneumococcal polysaccharide vaccination 23 strain and pneumococcal conjugate vaccine 13 strain. So these are advocated. As we discussed, pneumococcal pneumonia is the most common bacterial pneumonia seen in elderly patient. In order to prevent that, we give pneumococcal vaccination. So, and we know that COVID-19 booster, which has been in vogue since the past 3 to 4 years, and uh, Tdap vaccination is again advocated by the recent gold guidelines, which was given for COPD every 10 years. Zoster vaccine again to improve the immunity against zoster or zoster infections in lungs. All these vaccinations reduce the mortality, complications, and hospitalizations. So they may present to you with minor infection, but these vaccinations prevent them from getting into severe infection. So now, how do we prevent these infections? So vaccination is one part. Secondly, lifestyle modification is most important. One is, if you are an active smoker, please quit smoking and avoid exposure to smokers. So, as I told you, the people who are associated with smokers are also equally burdened with the effect of smoke. They are called as second hand smokers or third hand smokers or passive smokers. So, that should be totally avoided. Secondly, improving the air quality, probably indoors, probably outdoors, but the air quality has to be improved everywhere. We have to ensure that we are not exposed to susceptible antigens like bird droppings or animal danders or small hair particles or dust. Or it is advised for elderly patients to wear this ply masks if they are moving outside in traffic. And next most important thing is breathing exercises. We call something as deep breathing exercises in the form of yoga, pranayama, which provide an excellent platform for you to inspire and expire and practice the maneuver of breathing. And even walking makes you very active in terms of respiratory cycles. It keeps your respiratory cycles very active. And also it is important to practice healthy diet in forms of protein rich food, antioxidant and hydration. These things help help the lungs to maintain its elasticity and to perform its function normally. And this spirometry is known as incentive spirometry, whatever you are able to see here. It's called tribal exercise incentive spirometer, where it will allow you to measure your exercise capacity as well as improve your exercise capacity by doing simple inspiratory and expiratory maneuvers. You can see that the patient is blowing air inside, and there is one ball which has already reached the height. Still the patient has to blow more to get the other two balls to high. So, when to seek medical help? When should you come to hospital? Respiratory systems symptoms are very confusing in nature and often very atypical. It need not always present with cough and breathlessness, but many times patient present to you with different variety of symptoms. So, if you are experiencing sudden or worsening breathlessness, new or old cough, blood in sputum, unexplained weight loss, or unexplained fatigue, or if your saturation levels are going down below 94%, if you are having confusion, drowsiness, or behavioral changes over recent past, or if your family or caregiver is reporting that something is not normal, then you are always advised to attend the OPD. So it is always important for the family and the caregivers to recognize these early signs of respiratory system, and also ensure the adults are adhering to their medications and lifestyle changes. So most of the times what happens is we start the patients on inhalers, we diagnose, we do all the tests, even patients are very keen on it. But once they go home, they stop using inhalers because their symptoms are controlled. So it's very important to adhere to the medication that is given and to adhere to the lifestyle changes that have been suggested to the patient. And as I told you, vaccination and checkups which are done, should be done routinely, should be encouraged. And the diet, hygiene, and the mobility of the patient must be ensured in order to keep respiratory system very healthy. Also, emotional and social support becomes a very vital factor in maintaining the respiratory health. As in the case of COPD, as we discussed, patient will be sitting idly at home and he is more susceptible to psychiatric disorders like anxiety and depression. So, emotional and social support becomes vital in case of elderly patients suffering from chronic lung conditions. Hand hygiene, clean and safe home environment protects us from most of the respiratory illnesses. So, what is the take home message? Respiratory health defines the quality of life in old age. Many conditions of what I mentioned are mostly preventable or manageable. Vaccination must be advocated. Clean air, clean nutrition, and exercises are vital for respiratory health. Early detection and early diagnosis saves lives. And let's offer our elderly dignity, breathe, and care.
Very the respiratory pati.
Sir, kindly, Subramaniam sir, kindly mute yourself, sir.
Yes, yes.
Please mute, sir. Thank
Yes,
you,
that brings
doctor.
me to the end of the presentation. Now I want any questions that are there can be.
Thank you, doctor. Thank you, doctor. See,
Yeah.
there are some questions in the chat box. That is one thing.
Yes,
Before that, I think we are blessed with the two important people in the audience, doctor, today. Dr. Shankar Anand is associate professor in Kidwai. You are talking about cancer. I just thought whether he can add anything on that. That is one thing. And another important doctor is Dr. He's a geriatrician, Dr. Mahesh Hemadri. He's a geriatrician from Rajasthan, Mount Abu, Rajasthan. He's a practicing geriatrician. He is also there, doctor. If I just like to know whether they like to add anything.
yes, please, yes.
Yeah, yes,
sir.
doctor. Yeah.
Okay. Thank you, sir, Jamunathan sir.
Thank you. Please go ahead.
Can you hear me?
Yeah, please go ahead.
Okay. And that was a very elaborate and very nice, simple presentation, which I think it is helpful for most of the senior citizens. One thing about cancer, before coming to cancer, most of it is, unavoidable. If somebody is smoking cigarettes and all, I think you can't do anything about it, unless they stop it. One. Number two, genetic problems are a very big issue in this regarding the same. And the pollution may not be the Karnataka may not be as much polluted as in some parts of the world or even North India, but pollution definitely plays a role, and you just can't avoid it. Third thing, what you can avoid is about the respiratory health regarding the environment. That I think has been touched very clearly and cleanly by the doctor. So I want to add one thing, that especially the bird droppings, regarding the pigeon droppings. Whatever I seen in my apartments and all, people feed the pigeons. So this leads to an irreversible pulmonary condition where you can't do anything about it. I mean, it will go to a irreversible respiratory failure only. I think the doctor will elaborate more on that. My humble request is not to feed any pigeons. So we already have lost these sparrows. There is a disturbance in the ecosystem of these birds, and now because of this pigeon feeding, pigeon droppings is the major cause of respiratory failure. What I have seen in my apartment also, and also by the data, that the citizens are, especially the senior citizens, are requested to observe that the pigeons are not fed. Number one. Number two, regarding the snoring and obstructive sleep apnea, that has been touched upon. Uh, I think the doctor can tell about something about the respiratory yoga, something like Ujjayi Pranayama. Those are very, very helpful as far as I have heard. But non therapeutic observations. See, CPAP, not everybody can afford, and it's a very cumbersome procedure to follow. So, I think it is a totally a separate subject, but he can little briefly touch upon that subject where the respiratory exercises play a very important role in reducing the intensity of the sleep apnea and also the snoring as such. I mean, snoring is a general term, but the most severe form is the what is that? Obstructive sleep apnea, OSA. Yeah.
So that is Dr. Shankar Anand, doctor. He is the associate professor in Kidwai. In fact, he is the head of the department of blood bank.
Okay.
Thank you, doctor. Thank you, doctor.
Thank
Thanks for your contribution, doctor. See, Dr. Mr. Nagaraja Rao, who is a specialist in yoga, he is also there. See, he has already raised one question in the chat box. But in the meanwhile, if he likes to make any contribution, sir, Nagaraja Rao, sir, would you like to say anything, sir?
Yes, please.
Please.
Can I? Doctor, it was very interesting. I am following yoga. I had some small preliminary bronchial problems to start with 15 years ago. After starting yoga and the pranayama, I have overcome that. Now, thank God, blessings, no indications at all. But as somebody was telling about different varieties of pranayama, I feel that just deep breathing, slow breathing itself is more than enough than going in detail to any of the pranayamas. Oh. And the other point I have raised is, please mute others, please. Kindly mute, please.
I'm muting.
Ganesh, please mute.
Yeah.
Second point is about the Jalneti. I'm following Jalneti for the last 15 years. I never had any cough, any cold, any fever, no antibiotic for nearly 8 years. Could be one of the reasons, could be Jalneti coupled with pranayama. These are the two questions I would like to have. Thirdly, kindly share your mobile number.
Doctor, only one request is that if you feel that mobile number need not be shared, you can at least share your mail ID, doctor. So
email ID, yes, that's okay.
Mail ID is, in fact, I saw your FB page yesterday. Facebook page I saw yesterday, but I'm not very sure how often you visit the Facebook. Therefore, I did not send a message. If you can just share your at least mail ID, people who like to talk to you or connect with you, then can do that now. Because mail ID, I mean, I understand this sharing the mobile number could be a I mean,
That's okay. That's okay. Email ID is fine. Yes.
Yeah, email ID is fine, doctor. That is fine, doctor.
Okay. First, let's talk about the bird droppings, which sir told. So, yes, bird dropping. I also mentioned that bird droppings are a very serious concerns when it comes to respiratory health. It causes something known as hypersensitivity pneumonitis. All these contain very toxic substances which are not accepted well by the lungs, and it causes irreversible damage to the lungs and result in a condition called hypersensitivity pneumonitis. So this presents as lung webbing. So entire lung become very stiff and non-breathable. So once it sets in, there is no way out. We can manage the patient, but however, it is always better to avoid these kind of exposure. Not just bird droppings, especially this cat and dog danders or hairs of those common pets, and such fine dust should be avoided. Even for example, there are silica dust, aluminium dust, and factory exposure to chimneys and all that. All such things can cause what is known as hypersensitive pneumonitis, and it's always better to go with a mask wherever going outside to avoid all such kinds of exposure. And secondly, about OSA, yes, as sir told, it's a very tedious procedure or a cumbersome procedure for anyone to procure CPAP directly. However, there are so many modalities apart from CPAP as well for the treatment of OSA. There are so many therapies that are advocated nowadays. There are various small devices which can be kept in the nose clips, and oral devices which can be kept in the mouth while sleeping. And it's also seen that if you frequently change the position while sleeping, then it also helps you to overcome this snoring problem, where in if it a very mild case. So if you sleep to the left or right rather than sleeping in very straight position or supine position, then it helps you in overcoming this snoring problem if it's a very mild case. But in however, in advanced cases, we can't do anything. We have to go with the CPAP therapy itself. And definitely pranayama or deep breathing exercises will help, as it keeps the airways patent. And once the airways are patent, even in during sleep, that should not create a problem of this snoring at all. And thirdly, probably Jalneti, I don't know much about the procedure per se, but it definitely can help in one keeping the respiratory tract healthy, because the whatever the airway secretions are there in the upper respiratory tract are cleared by this particular exercise. So it keeps the airway patent, and once the airways are patent, there are less chances of infection. Thirdly, deep breathing exercises in the form of inspiration and expiration, very simple deep breathing, can itself help any patient to maintain a very healthy lung. So it's not essential to do strenuous activities or strenuous muscle strengthen exercises, but just deep breathing in the form of inspiration and expiration will keep a patient very healthy and avoids most of the respiratory illnesses if practiced in the elderly age group. And
Thank you.
thirdly, and next I'll come to the questions that are in the question box.
Yes, doctor.
Yes. So, Dr. Mahesh sir has asked something about, please kindly answer this question. What are the indications of long-term oxygen therapy in COPD patients? Sir, this is a very personalized treatment option that is given for the patient. If the patient is diagnosed with COPD and is unable to maintain his saturations, and it should be proven with blood testing. So ABG should be done, what is known as arterial blood gas should be done. And if the arterial blood gas shows deficit of oxygen less than 60 millimeters of mercury, such are the patients who are given long-term oxygen therapy. So many times what happens is that patients won't come to pulmonologists but consult different physicians or any these things, and ABG will not be done in all cases. So it can lead to so many conditions. If unadvocated use of long-term oxygen therapy may result in so many complications like hypercapnic respiratory failure or unconsciousness or type 2 respiratory failure in the later stages. So it's always indicated and advocated that you visit a pulmonologist before you initiate long-term oxygen therapy. Secondly, sir, how long safely can we give acebrophylline in elderly? Acebrophylline being a theophylline, it's a very temporary measure to relieve bronchodilation, to achieve bronchodilation, and it is not advocated for long term usage of acebrophylline because it has its effect on the heart, it has its effect on the respiratory system, parabdominal system, and all the systems. So safely it can be given up to 2 to 3 weeks, not more than that. And which is the best decongestant in the elderly? Again, this is of individual choice and the cause that has caused the congestion. So if it is a very mild upper respiratory congestion that has happened because of viral illnesses which we see during this winter and the monsoon season, then just steam inhalation will do. Also, steam inhalation with all these decongestants like vapocaps and vaporubs and all that, that also will be of help. But if it is a very severe decongestion, then nasal drops of oxymetazoline or xylometazoline can be used for very short while, but it's not advocated for more than a week period.
Thank you, Doctor. I think all his questions have been answered. And there is one more question, Doctor. Is the adolescent asthma curable?
Sir, can I have one more comment regarding the
Yeah,
Jalneti?
go ahead. That is Dr. Shankar. Yeah.
Okay, yeah. So, so Jalneti, this is a personal experience of mine. While doing MBBS in Mysore Medical College, so I used to have the every year, at least 2 to 3 months, I used to have some respiratory infections. Like it used to start with the cough, cold, with the sneezing and the nasal obstruction, and then lower respiratory tract infection. So sore throat and all that. And it was not treated by anything for almost till 2020. So in 2020, I joined a course in SVASA, and so there we had been taught about the one Jalneti. So that Neti pot, I tried earlier also regarding Jalneti, but I was not successful. So when I did that Jalneti in SVASA, and there is a proper procedure to do that Neti. If you don't do it properly, definitely it will not give any results, and it will be more harmful than being productive. So when I did that Jalneti, that was only for 3 or 6 months course. So from 2020 till day, 2025 till day, I didn't have even a single episode of sore throat or cough or respiratory tract infection. Number one, I didn't even have COVID also because I joined before COVID. I didn't even have COVID at that time. So Jalneti is definitely, I will recommend. I have tried everything under the sun, everything in allopathy, everything in Ayurveda regarding my respiratory infections. And but Jalneti changed the whole perspective. I don't since last 5 years, that's almost half a decade, I didn't have even a single episode, not even a single episode of cold, cough, or respiratory infections. So I definitely recommend everyone to do this Jalneti. It costs only 25 rupees. That Neti pot costs only 25 rupees in SVASA. And everybody can take that. And if people who are having that respiratory tract infections can practice this and also get benefited. That is my experience on this Neti. Thank you.
Thank you, Doctor.
Can I react on this, Jamunathan?
Please, sir.
Thank you very much, Doctor, for having supported Jalneti. But I feel Jalneti alone will not be enough. Jalneti keeps the track clean, but pranayama adds on to it to support the lungs. The experience of mine is I conduct online classes of pranayama and meditation. Second factor which has not been touched upon is the stress. And if the stress is more, all these things can be cannot be overcome. So on one hand, stress is to be reduced. On the other points. The experience of mine is nearly 40 people attend this pranayama class. and none of them suffered from COVID during that particular time. Is my feedback, sir.
That's all. In fact, even now, doctor, he is conducting these pranayama classes, and we are also attending the classes, and we are benefited by that. No doubt about it. We are all benefited by that this thing, and I will strongly recommend people to attend that. It's really good. That's one thing, doctor. But anyway, I don't know whether in a forum where we are talking about this, allopathic, this can be talked. But because see, this is all. I mean, we are talking of evidence-based things, and evidence-based is large number of evidence-based. But these are all evidence-based from small number, but anyway, significant number in the sense that we have been benefited. That is the only significance. Thank you, doctor. Thank you. That helps, doctor. And there is one more question from Mr. Vasudevan. He has asked a very, very, very pertinent question, doctor. Is it curable? That is the adolescent asthma curable?
So when it comes to bronchial asthma, it is like diabetes mellitus. There is nothing like cure for that, but it can always be brought to remission by taking some measures. It can always be brought to remission that there won't be any further episodes of wheezing in the future. So that can be achieved, but once the airway has susceptibility, there is nothing like a cure for the disease. It is already genetically modified of for that particular exposure. But again, when the patient has been treated with in the right way after proper diagnosis, it can be brought to remission, and we can ensure that there are no further exacerbations, or there are no further episodes of wheezing in the coming years. So many patients will not have no episodes of wheezing for up to 20-30 years after diagnosing and properly initiating on medications. So that is about bronchial asthma.
Thank you. Thank you, doctor.
Good evening, doctor.
Yeah, please go ahead, sir. Please
Doctor,
go ahead.
I have a small question. I go for walking in the morning. So deep breathing, fast walking also is equal to deep breathing, doctor?
They both are different, sir. And the deep breathing exercises help to reach the total lung capacity. There is something known as total lung capacity. It reaches your fullest of the lung. So when you take deep breaths, it will reach the deepest part of your lung and opens up the areas of the lungs which are not often used. But fast breathing doesn't do that. It makes everything in a hurry. It increases your respiratory rate. It increases the rate of your breathing, but it will not reach the depths of your lung. So that is the basic difference between these two.
I got it, doctor. Thank you.
Yes.
Even then, doctor, deep breathing cannot fill up the entire 5.6 liters of the lungs.
Yes.
Sir, you are muted, sir. Sir, you are muted. He is not there in the line at all. He has gone out of the line. So any other person has got any other doubt, sir? Anything else? Doctor is a busy doctor. Yeah. Lots of encomiums are coming, doctor. Wonderful presentation, doctor. Very informative session for us. In fact, doctor, it was very informative in the sense that this is a very, very common disease, as you have rightly pointed out at the beginning. And most of the senior citizens are facing it today. And you have given beautiful solutions to that also, in the sense that, especially when you have talked about this pneumococcal vaccines. I think, can you just lay a little more about this vaccine, doctor? Is it given free of cost at government hospitals for the senior citizens?
Currently, when we see the statistics and the immunization program, it is not given free of cost in the government as of now. But government has taken a feedback from all of us, the pulmonologists, to have include what is known as adult vaccination schedule. Probably it will enforce in the coming years, probably in the recent future itself, probably in another year or so. But as of today, if you ask me, no, it is not given free of cost, but it is included in the adult vaccination schedule.
Right, doctor? But can you just indicate a cost, probable cost?
Probable cost for influenza vaccine will be somewhere around 1,000 rupees per annum. That is an annual vaccine. Pneumococcal vaccine is given every 5 years once. So that will cost you around 1,500 to 2,000 rupees.
Okay, only that much. See,
Yes.
because in the internet, etc., we see 4,000, 5,000 like that.
No. It is available in this thing at 1,500 to 2,000.
Okay, doctor. Supposing we come to your hospital and supposing we are willing to pay, will you be able to administer it, doctor?
Yes.
That is a great news, doctor. That's great. That's so that our people, most of the people who are all in Bangalore, at least they can visit you and take this vaccine. But I have taken pneumococcal vaccine. So, and in fact, every year I am also taking this flu vaccine. So it helps, no doubt about it, it helps. And you know, the recent finding is also that it will be useful for certain mental conditions also. It's an additional plus. Thank you, doctor. It was a wonderful presentation. Very good, doctor. Fantastic.
Thank you so much, sir. Thank you everyone.
Thank you.
Before we go, madam, she may like to say something, doctor. Yeah, please come.
Thank you, sir. Thank you, doctor, for this insightful session. Your information was broken down in such simplistic and understandable way. Especially, I feel like the information caters to all age groups, even if they were to refer to this video in the future. So thank you for sharing your insights, and we would love to be in touch with you, sir.